Morning, everyone. My name is Shantae Perry, and I'm going to be doing a training on insurance claims processing. There are various types of insurance. You have the traditional managed care, Medicaid, and Medicare. The type of insurance you have depends on your needs and your healthcare preference. Traditional and managed care. Traditional managed care plans consist of four basic types of plans. The fee-for-service plans allows you to refer yourself to a specialist without needing prior authorization. These plans involve more out-of-pocket expenses. The PPO have lower fees, but the provider must be within a network organization. The POS is similar to PPO, but they introduced the primary care physician. The HMO plan is the least expensive, but requires that you only see its doctors and that you get a referral from your primary care physician before you see a specialist. Medicaid. Medicaid is a federal and state funded program that helps with the medical costs for some people with limited income and resource. Medicaid offers benefits not normally covered by Medicare, such as nursing home care and personal care services. Medicaid is also known as the government insurance programs for persons of all ages whose income and resources are insufficient to pay for health care. It is the largest source of funding for healthcare services for low income people. Medicare is based on three main factors. You have the federal law factor, the national coverage decision made by Medicare on whether something is covered, and third, and local coverage decisions in each state that processes the claim. There are four parts to Medicare. You have Medicare Part A, B, C, and D. When a person turns 65, they're eligible for Medicare. You can also be 65 receiving Social Security disability or Social Security disability supplement to qualify for Medicare. Medicare Part A and B. Medicare Part A usually covers inpatient care, skilled nursing facilities, hospice care, and home health. It provides both inpatient and outpatient services. Medicare Part B covers necessary and preventive service. Examples are clinical research, ambulance service, mental health, and durable medical equipment. Medicare Part C. Medicare Part C is now also known as the Medical Advantage Plan. This is a form of Medicare plan that is offered by private companies. These plans offer extra coverage. These extra coverages includes but are not limited to vision, hearing, dental, and health wellness programs. Most include Medicare Part D, which is a prescription drug plan. Advantage plans can specify different out-of-pocket costs and have different requirements for attaining services. Next, you have Medicare Part D, and this is a prescription drug plan which varies. You must be enrolled in Part A and B to enroll in Part D. It's optional that help pays for out-of-pocket patient prescribed medications. Next, my next topic I'm going to talk about is billing for insurance claims. There are two types of code used. You have the CPT and you have the ICD-10. The CPT, which is known as the Current Procedure Terminology, was developed by the American Medical Association, known as the AMA. It is the level one of the Healthcare Common Procedure Coding System. It is a medical set that is used to report medical, surgical, and diagnostic procedures and services such as physician, health insurance such as performed by physicians, health insurance companies, and accreditation organizations. The ICD-10 is a system used by physicians and other healthcare providers to clarify and code diagnosis, symptoms, and procedures recorded in conjunction with hospital care. The only reason you will be required to use ICD-10 codes if you are coded an inpatient procedure at a hospital. All outpatient procedures will be used using CPT code. So for our purposes, for an office building, we will be using the CPT codes. When processing a claim, there is four basic steps to life cycle of there's four basic steps to a life cycle of an insurance claim. The cycle consists of submission, processing, justification, and payment denial process. And we're going to go through each one of them briefly. And if you have any questions, you can stop me at any time. The submission. The submission is the transmission of claims to an insurance carrier. It includes logging, electronic claims, and data entry. This is where the documentation of service and supporting medical documentation is submitted. This is a key component of the process because submitted documentation can determine the outcome of a claim being denied or supported for payment. Next, you have the processing status. The processing, I'm sorry. Next, you have the processing of the processing status, and it consists of members' benefit verification and eligible checks. Processing is completed by the payer by collecting information about the patient, provider, and services performed from the insurance claim form. If not all documentation is correct or supported, the render service, the render service The render service may have a delay occur in the process. Accuracy is one of the chief concerns for medical biller and coders during this process. Next, we have the education process, which consists of the DRG, the payment unit, the claim authorization policy segments, and audits. This is when the service and information reported on the claim is compared to a payer and the patient's health benefits. At this stage, the insurers determine what percentage of billing for the service they're responsible for. It all depends on how the patient is covered under the benefits. The payment of a denied status is also determined here. The final steps is payments and denials. And this is where a claim is either, if the payment is approved for the provider, is submitted electronic funds transfer or mailed to the provider. Also, if it's denied, the some insurance company have give you up to 100 days to submit what they call a appeal, and this is the appeal the decision on what the insurance company made to determine or to justify why payment is needed or what was missing that payment was not received. Some of you might ask, how does the process start? Claims are submitted on a what they call a UBO form. Your UBO form is the standard claim form that any institution provider can use for the billing of medical and mental health claims. It was developed by the Centers for Medicare and Medicaid and has become the standard form used by all insurance carriers. This is the standard format to use by providers to transmit health claims electronically. The form CMS 1450, also known as the UBO4 form, is the standard claim to bill Medicare administration contractors when a paper, claim is allowed. So to sum it all up, the UBO4 is the electronic version and the CMS 1450 is the paper version. In this century, I'm thinking 98% of the billing now is done electronic, um, especially through Medicare and Medicaid. This has concluded my presentation. If you have any questions or concerns or any advice for me, please say so now. Thanks, and thank you for listening.